Welcome back to my channel. Hello guys, I hope you're all doing great. Today's video is about yeast infections. What is it, who gets it, causes and effective natural remedies to treat yeast infections. So let's get right into the video. Home remedies for vaginal yeast infection can help you get some relief in the initial stages of the infection as an alternative for antifungal ointments. A vaginal yeast infection often starts with mild discomfort and can lead to a foul-smelling discharge and burning sensation down there. This might feel very discomforting and irritating. Yeast infection can happen to anyone and affect the warm and moist areas in the body, but women tend to have vaginal yeast infections more often. Yeast infection is usually caused by the fungus Candida and affects as many as 75 out of 100 women worldwide. While women are more prone to it, men can sometimes get it as a sexually transmitted disease. If you doubt that something is off down there, you can opt for a medical diagnosis or begin treatment with some of the home remedies for vaginal yeast infection discussed here. What are the types of yeast infections? Yeast infections can be of various types, depending on the affected part of the body or the strain of yeast causing the infection. The most common types of yeast infections include 1. Candida auris. This is an invasive and difficult to treat yeast infection caused by a strain of yeast known as Candida auris. 2. Candidemia. Candidemia is the condition where the yeast infection is present in the bloodstream. 3. Genital, vulvovaginal candidiasis. An yeast infection in the genitalia or the vagina is commonly referred to as genital or vaginal candidiasis. 4. Invasive candidiasis. This is a serious yeast infection that spreads to the heart, lungs, eyes, brain and other parts of the body from the bloodstream. 5. Oral thrush, oropharyngeal candidiasis. Oral thrush is yeast infection in the mouth or throat which presents white patches as the most common symptom. 6. Esophageal candidiasis. Candidiasis, or a yeast infection caused by Candida in the esophagus, the tube connecting the throat and the stomach, is called esophageal candidiasis. 7. Tinea versicolari. This is a fungal infection of the skin. What causes yeast infections? Yeast infections are caused by a type of fungus called Candida. This fungus has about 20 different strains that cause infections in different parts of the body. Candida albicans is the strain that is most commonly responsible for yeast infections, especially vaginal yeast infections. Under the influence of antibiotics, cortisone drugs, and other medications, yeast can overgrow in the intestines and migrate to the vagina. That's why it's important to treat vaginal yeast infections both locally and body-wide. Let us now take a look at the signs and symptoms of a yeast infection. What are the signs and symptoms of yeast infections? Yeast infection is also known as candidiasis. It can occur on any part of the body. It is most commonly seen in the oral parts or genitals. Oral yeast infection, or oral thrush, has the following symptoms: white patches in the mouth, difficulty in swallowing food, pain in the infected part. The signs and symptoms of a vaginal yeast infection are as follows: unbearable itchiness in and around the vagina, swelling, redness, and burning of the affected area, white discharge that looks like cottage cheese but has no smell, burning sensation or pain while urinating, pain during sex, soreness. 1. Apple cider vinegar. ACV possesses antifungal properties against Candida. Therefore, it may help facilitate recovery from yeast infection when applied topically. In addition, when consumed in an undiluted or mildly diluted manner, it may promote a hostile environment for certain Candida species, yeast, and curb their growth. Note: undiluted ACV may irritate the sensitive vaginal area, so it should be used with caution and in a properly diluted manner. You will need 1 to 2 tablespoons apple cider vinegar, a glass of water. What you have to do: mix the ACV in the water and drink it up. Alternatively, mix 1 cup of ACV in a lukewarm bath and soak in it. How often you need to do this? Do this 2 to 3 times a day. 2. Garlic. Garlic exhibits strong antifungal activity against Candida species, making it an excellent and easy home remedy for yeast infection. You will need 2 to 3 cloves garlic, water. What you have to do: swallow 1 to 2 garlic cloves with water. How often you need to do this? Do this 1 to 2 times a day. Caution: do not use the garlic paste on sensitive areas, such as the vagina and inner thighs. 3. Tea tree oil. This is yet another favorite amongst naturopaths. Tea tree oil is antifungal, antiviral, and antibacterial. Along with the honey or warm water, it also soothes the inflamed skin. You will need 3 drops tea tree oil, 2 tablespoons honey. What you have to do: mix the essential oil with the honey and apply this mixture to the affected area. Leave it on overnight. Rinse in the morning with lukewarm water. You can also soak an organic cotton tampon in 2 to 3 drops of tea tree oil diluted in 1/3 cup of warm water. Insert this into the vagina and leave it overnight. How often you need to do this? Do this for a few nights before going to bed. Caution: tea tree oil is extremely potent. Do a patch test and wait until 24 hours to notice any reaction. 4. Yogurt and probiotic combination therapy. A combination of yogurt and honey was found to relieve a few symptoms of yeast infection. Another study showed that consuming yogurt could help reduce the spread of Candida fungi. Note: while there is some evidence to support the topical application of yogurt for the treatment of yeast infections, it should be used with caution. The natural sugars present in yogurt and honey, in the case of combination use, may aggravate a yeast infection in some individuals, especially when applied to the vagina. You will need plain yogurt, cotton tampon. What you have to do: dip the tampon in the yogurt and slip it into the vagina. Make sure not to push it in too far. Leave it in for an hour or 2. How often you need to do this? Repeat this every few hours. 5. Coconut oil. It can help in treating fungal infections caused by drug-resistant Candida strains. It showed significant antifungal activity against Candida albicans, which is comparable with ketoconazole. You will need virgin coconut oil. What you have to do: wash and dry the affected area thoroughly. Use a soft cloth so do not irritate the inflamed skin any further. Apply a thin layer of coconut oil over the area and keep it on. How often you need to do this? Do this 2 to 3 times a day. 6. Aloe vera. Aloe vera gel can help soothe irritation and alleviate inflammation in the affected area. It also displays antifungal effects on C. albicans. You will need fresh aloe vera gel. What you have to do: extract aloe gel from a leaf. Apply this freshly extracted gel in a thin layer over the affected area. Let it air dry. How often you need to do this? Reapply 2 to 3 times a day.
Thanks for watching. If you like this video, please consider subscribing to our channel for more healthy tips. See you in the next video.